There is one question that most of my patients always ask me when I'm giving them their blood results. So usually it depends. It can be their CD4 count, it can be their viral load. But most common one that they don't know, they don't even understand, is viral load. So I would usually say, these are your blood results that were done the last time you were here. Your kidney function is normal. Your viral load is undetectable, or your viral load is very high. It is 2000 and whatever, or it is 500 and something. And then they would be like, I actually had a patient even today, an old lady said to me, a viral load, intoni leyo ke ngumntanam? What is that? So I'm just here to explain those two. I want to try and explain them both in English and isiXhosa, okay? Once a year, someone who's living with HIV, they have to do bloods. Can be once a year or every 6 months, but then the government says once a year. But in some cases, okay, it can be done every 6 months. It depends on every case, but most people once a year. If everything is stable, then once a year. What is a CD4 count? A CD4 count is, or it represents your immune system. How strong your immune system is, or how weak your immune system is. I-CD4 count yakho ngamajoni akho omzimba la athi xa unesigulo onaso esithile kulwe wona. I-CD4 count leyo wonke umuntu unayo, kuba i-immune system yethu kumzimba ilento ikulwelayo xa ugula. I-viral load yintoni? Viral load is the amount of the HIV in your blood. It is the load. It's a quantity of the HIV in your blood. I-viral load bubungakanani be-HIV. Siskali sobungakanani be-HIV egazini lakho. Now, the goal is for your CD4 count to keep going up. That means your immune system is getting stronger, and the goal is for your viral load to go down to the point of being undetectable. Xa usitya ipilisi, igoal yeyokuba amajoni akho omzimba mawanyuke wona, intsholongwane yona mayihle to the point yoba ingabonakali, sithi i-undetectable. Ndiye ndithi ke mna kwi-patients zami into yoba iyafana nokuvalelwa, ingathi ivalelwe ekhabhathini okanye ingathi uvule idrowa wayivalela. It's locked up. The HIV is locked up. You are still living with HIV. There's HIV in your blood, but it's undetectable. That is powerful. And it's very empowering when you tell the patient that, they get excited. Wow, sister, it's undetectable. So that is the goal. But then there are people whose viral load is not detectable. Is not undetectable, is actually detectable, which means that there are more than 50 copies in their blood. It can be 100 copies, it can be 1,000 copies, it can be millions of copies. But if you are on treatment and the treatment yakho uyisela kakuhle, kumele ukuba i-viral load ingabonakali, meaning ube na less than 50 copies. Zininzi ke izinto ezenza uba i-viral load mayingabikho right. Ne? Uba uzitye kakuhle ipilisi, uba kukho izigulo onaso, i-opportunistic infections, uba sexually, maybe you have, especially having sex without a condom. You can actually be two people who are HIV positive, but you sleep together and your viral loads are not the same, and they can be a transfer. And I believe you can also be infected with a different type of HIV. And also not taking your pills. Some people, they stop taking their pills for a reason. Some people, they struggle because they've not disclosed their HIV status. So sometimes they don't take their pills because they don't want to get caught. Those things are not good because they all make your viral load to be high. Remember, if the viral load is high, the CD4 count goes down. The higher the viral load, the lower the CD4 count. The scales are always like this. The scale is always like this, okay? It's important to have an undetectable viral load, because if you have an undetectable viral load, that means you cannot infect someone else with HIV. That means if you are pregnant, your baby will not be infected. That means when you have a baby, you can breastfeed that child without the worry of infecting that child. That means the HIV is no longer damaging your immune system. You can live a healthy life. So undetectable is equal to untransmittable. And also undetectable can also be prevention for the partner, because you won't infect them. So guys, I just wanted to explain that, because I know I've seen that it's such a gray area.